Hi everyone, I am Dr. Shahan. Today in this video I will teach you about mesenteric cyst. Now why I have chosen this topic of mesenteric cyst is because mesenteric cyst is a hot topic for examination like FMG, NEET PG and INISET examination. So if you are preparing for any of this examination, please subscribe this channel. This channel contains so many videos free of cost you can watch. So mesenteric cyst, look at the picture first. This is mesenteric cyst. How can we understand mesenteric cyst? There are certain there is a triad by which we can understand it. The name of the triad is Tilloch's triad. I will describe in details what are the types of mesenteric cyst and by what triad you can understand. Everything is clear in this video. Watch the video continuously. Now look at this triad. This triad is Tilloch's triad. This triad is Tilloch's triad. Tilloch's triad is very important for your examination because they will ask you Tilloch's triad in regard with mesenteric cyst. Mesenteric cyst. Tilloch's triad is seen in mesenteric cyst. So what are the three components of Tilloch's triad? Number one, there is a swelling in the periumbilical region. There is a swelling in the periumbilical region. Number one. Number two, this swelling moves perpendicularly to the mesentery. This swelling moves perpendicularly to the mesentery, perpendicular to the mesentery. Number three, there is zone of resonance. There is zone of resonance or band of resonance around it. So three important things are there in the Tilloch's triad. You must remember, they may give you which of the following is not a part of Tilloch's triad. These three they will give, along with that they will give another option. So you have to mark that another option. So Tilloch's triad is seen in mesenteric cyst. Number one, soft fluctuant swelling is there. There is a soft swelling and that swelling is fluctuant. Number one. Number two is, yes, this one, what is shown in the picture, that is, it moves perpendicular to the mesentery. It moves perpendicular to the mesentery. And number three is resonance. Band of resonance is there. Number three is band of resonance is there around. So look at this picture. This picture is showing that it move, mesenteric cyst can move perpendicular to the mesentery. Look at the green arrow. The green arrow is showing mobility of the cyst and the red arrow is the attachment of the mesentery. So the green arrow is the movement of the cyst. How the movement of the cyst is there? It is perpendicular to the attachment of mesentery. And remember, if they ask you Tilloch sign, this is the Tilloch sign. That is the movement. The second point, the movement of the mesenteric cyst perpendicular to the mesentery. Movement of the mesenteric cyst perpendicular to the mesentery. This is the second point and this point is known as Tilloch sign. Now look at this picture. This is a huge mesenteric cyst. This is a huge mesenteric cyst and it has been resected. You can see. Now look at this slide. This slide shows the two important type of mesenteric cyst. There are two types of mesenteric cyst. What are the two types? Number one is chylolymphatic cyst. Number one is chylolymphatic cyst. Chylolymphatic cyst. Number one. Number two is androgynous cyst. Right side you can see androgynous cyst. So the name itself says some characteristics. In the left side you can see chylolymphatic cyst. So there is sequestered lymphatic tissue. There is sequestered lymphatic tissue in the chylolymphatic cyst. On the right side you can see androgynous cyst. Androgynous cyst. There is sequestered bowel tissue in the androgynous cyst. Androgynous, the name itself says androgynous. So there is sequestered bowel tissue. On the left side, chylolymphatic cyst. So lymphatic tissue is the sequestered tissue in the chylolymphatic cyst. And there is a special characteristics of chylolymphatic cyst. Chylolymphatic cyst has its own blood supply. So we can do a procedure known as enucleation. We can do a procedure known as enucleation by which we can basically take it out. So chylolymphatic cyst has its own blood supply. Look at the blood vessels. It has its independent blood supply in the chylolymphatic cyst. But on the right side you can see endogenous cyst. This cyst share its blood supply with the bowel. Endogenous cyst share its blood supply with the bowel. Right side you can see endogenous cyst shares its blood supply with the bowel. So basically we cannot do enucleation, we have to go for resection and anastomosis. Resection and anastomosis. So these are the important question. On the chylolymphatic cyst we do enucleation, on the endogenous cyst we do resection and anastomosis. Now look at this slide. This slide says the important points for the chylolymphatic cyst. I told you chylolymphatic cyst is the most common type of mesenteric cyst. Remember which is the most common type of mesenteric cyst? That is chylolymphatic cyst. Chylolymphatic cyst is the most common. Among the two, among chylolymphatic cyst and endogenous, which is the most common? Chylolymphatic is the most common. Chylolymphatic cyst is the most common type of mesenteric cyst. Number 2 is very important, sequestered lymphatic tissue is there. Sequestered lymphatic tissue is there. And what kind of cyst is this chylolymphatic cyst? Basically it is thin walled clear fluid cyst. Thin walled clear fluid cyst, very important. Chylolymphatic cyst has thin wall and clear fluid is there. From the C you can remember chylolymphatic is clear fluid. Clear fluid is there and thin wall is there. And what is the treatment? I told you chylolymphatic cyst has its independent blood supply. It do not share its blood supply just like the endogenous cyst. Endogenous cyst shares its blood supply, but chylolymphatic cyst do not share its blood supply. So as it do not share its blood supply, it has its own independent blood supply. So we can do enucleation. We can do enucleation. That is the treatment for chylolymphatic cyst. Look at this picture. This picture is showing enucleation of the chylolymphatic cyst. It has its own blood supply, so we can do enucleation procedure. Now look at this slide. This slide contains endogenous cyst. Endogenous cyst has sequestered, yes, bowel, sequestered bowel. Endogenous, the name itself says, number 1 point. Second point, endogenous cyst have thick walled and turbid fluid in it. Another very important characteristic is it shares its blood supply. I told you it shares its blood supply with bowel. So we cannot do enucleation. For here the treatment is resection and anastomosis. Resection and anastomosis is the treatment for endogenous cyst. All these are important questions. Look at this picture. This picture is showing the endogenous cyst. And what we have done? Resection and anastomosis. Why we have done resection and anastomosis? Because, yes, because it shares its blood supply with the bowel. Because it shares its blood supply with the bowel. So we cannot do enucleation. Here we do resection and anastomosis. So remember resection and anastomosis of endogenous cyst. Now look at this slide. This is actually CECT, investigation of choice of mesenteric cyst. What is the investigation of choice of mesenteric cyst? They will ask you CECT, contrast enhanced CT. Contrast enhanced CT is the investigation of choice of mesenteric cyst. Contrast enhanced CT. CECT is the IOC, investigation of choice of mesenteric cyst. So this is the end of this video. Please subscribe this channel and please make a thumbs up and write down in the comment section below if you like this channel. This channel contains so many medical videos. All these are disease videos, free of cost you can watch. You just need to press the subscribe button. Thank you. Have a nice day. Bye bye.